Okay, so the first exercise in the UCL rehabilitation program is going to be ball squeezes. Ball squeezes produce movement in the wrist and hands. First, have your patient start in a neutral position with their elbow flexed about 90 degrees. After, place the ball in the hand of the injured extremity and have them squeeze on the ball as hard as they can for about 6 seconds. After the 6 seconds has passed, have them release pressure. And after the 10 seconds, have them repeat this motion from 8 to 12 times. The second exercise is going to be elbow isometrics. These are going to strengthen the biceps by creating a force on a fixed object. Have your patient place their hands in a supine position underneath the table. After that, they will create an upward force, holding that force for 6 seconds. After 6 seconds, they will take a 5-second break to release the pressure, and then repeat this exercise from 10 to 12 times.
So one of the exercises that we can use for UCL reconstruction for each exercise would be a forearm recovery. The only thing that you need is a dumbbell table to have her arm rested comfortably at, and maybe a mat just so that she feels more comfortable, or the client feels more comfortable. Now, one of the reasons why it's important for us to do this exercise is that it's a straight line movement which will isolate the forearm muscles to strengthen the elbow area and the ulnar area. So now what she's going to do is she's going to push that dumbbell forward towards her face. While doing that, she's going to keep her back straight, neutral, and go as far as she can. And here she's doing a good job.
Alright, for the second exercise that we can do for UCL reconstruction grade 2 is the active elbow extensor stretch. And so the importance for it is to isolate and strengthen bicep muscles and increase elbow flexion. And so the only equipment that you need is a towel to put into the crease, as well as a table or a mat for your client to lay on, and maybe a pillow or two just for comfort. So now what she's going to do is that she's going to she has the towel in between the crease as far as she can, and now she's going to use her collateral hand, there you go, to bring that elbow and arm towards her face. Okay, and she's going to, after a 15 to 30 second hold, she's going to bring it down. Okay. And she's going to continue again for another 15 to 30 seconds for 3 rounds.
So now we are in the third stage of the rehabilitation process, which is the resistive phase. And so the goal of this phase is to achieve full range of motion and achieve normal strength in your elbow, wrist, and hands. So the first exercise we're going to do are elbow extensions. So your patient will elevate their shoulder and extend that elbow directly over the shoulder, maintaining that position over the head. You want to make sure that your elbow does not torque or valgus, and make sure it remains that steady position. And to help with this exercise, the patient will put the opposite arm on the back of the humerus to maintain that stable position. You can do 3 sets of 10, and the weight can vary between 5 to 10 pounds. So the second exercise will be wall push-ups. This will promote strengthening in your biceps and your triceps. So first, you want to stand with your feet shoulder width apart and have your arms a little further than arm's length away from the wall. Next, you will lean slightly forward, placing your palms on the wall. Make sure your arms are straight and that your torso is erect. Next, as you breathe in, you will bend your elbows and lean towards the wall. You will hold this for 1 second and breathe out as you push away from the wall. And you continue it again. And make sure you're squeezing your core. Then you will do 2 sets of 10 for this exercise.
Okay, so this is the UCL program rehabilitative stage. This is the aggressive phase that we're going to be working on, phase 4 with my client. She's going to be doing the standing single hand wall ball throw. She's going to be standing on the side with the injured arm doing most of your work. Catching with both hands and releasing with one. Making sure to have a bend in the knees to make sure that she has stability when she comes down and picks it back up. So the patient's going to be doing 3 sets of 10 in order to re-strengthen the ligament in her arm. Start. Okay, so this is the second exercise that we're going to be performing with my client right here. We're going to be performing the wall dribble with the ball using her injured hand to regain strength in her UCL ligament. And this is going to be performed doing hitting the ball against a wall with an arc in order to manipulate the overhand throwing baseball pitches that most of our clients do, or depending what their sport is. She's going to start making sure to go as fast as possible in an arc, and the closer she gets to the wall, the better the stretch of the ligament she'll get.
Okay, the first exercise in the ACL reconstruction rehabilitation program is going to be straight leg raises. This is going to straighten your quadriceps isometrically. First, you're going to have your patient lie straight on their back and contract their quads. Next, you're going to have them raise their leg fully extended about 8 inches into the air. Have them hold this position for about 5 seconds and then release. Make sure that the hip stays in a neutral position and that the quads are fully contracted. The second exercise in the ACL reconstruction program is going to be wall slides. This is going to increase knee flexion and promote range of motion. First, have your patient lay flat on the floor and have a partially extended leg with the foot on the wall and a towel beneath the foot. Then, have your patient flex their knee as far as possible and then return back to partial extension. Make sure that the ankle, knee, and hip remain in good alignment.
Exercises that we can do for ACL reconstruction grade 2 is a step up and a half squat to a 45-degree angle. So with the step up, all the equipment that you need is a platform for your client to step onto. The reason why it's important is because it's a functional movement, which means that you can do it every day. And so we're going to strengthen those muscles, which is the quadriceps when you go up, and the glutes and calf muscles as well. So within this exercise, my client is going to step up with her rehabbing extremities, and she's making sure that her knees are not going over her toes, and that she's using her muscles in the rehabbing extremity to go up. So that means that she's firing those glutes, firing those quads. The second exercise for a ACL reconstruction grade 2 is the half squat to a 45-degree angle. There are no equipment needed for this, but the reason why it's important is because it is really good on your joints and doesn't put a lot of pressure on your kneecap. So what she's going to do is she's going to stand athletic stance, shoulder width apart, and she's going to go squat down into a 45-degree angle, come up, and as you can see, her back is very neutral, her neck's neutral.
Okay, so for the first exercise for the resistive phase for ACL reconstruction rehab, we'll do backwards sprinting or running. So first, you want to have your patient slightly bend their knees shoulder width apart and squeeze your core. Then have them flex their arms at 90 degrees, so when they push off with their forefoot, they'll begin pumping their arms. If you find that your patient is leaning slightly backward and losing their balance, when they squeeze their core, make sure they lean just slightly forward, so when they bend their knees and push off again, they won't fall backwards. Okay, so the second exercise would be double leg hops side to side. This also will promote strengthening in your quadriceps and your hamstrings. So first, you want to make sure your feet are shoulder width apart, and then you will bend your knees in the the squatting position. Make sure that your trunk stays straight and then your hips, knees, and toes are lined forward and that your knees are not coming over your toes. And so as you jump side to side, you will jump symmetrically and try to land softly, making sure you're keeping your core tight. As you jump side to side, you'll cover a 6 to 12 inch distance. You will do this 10 times, and as you progress, you can include cones and ladders to increase the difficulty of this exercise.
Alright, so this is stage 4, the aggressive phase of the ACL reconstruction program. I have my client right here. She's going to be performing 4 sets of 12 repetitions of lunges. She started out with non-weight and then moved up to small weights in order to strengthen out the muscles in her thighs and stretch out her ACL. So now she's going to start beginning. She's going to do a few reps of the lunges. She's going to make sure she goes all the way down, keeping her body stable. Posture is completely straight. If she loses a little bit of stability, she needs to make sure to regain it and without injuring the ACL again. And once the program continues on, she's going to continue to increase the weight in order to get her legs and the ligaments around the knee stronger. Okay, so this is the second exercise, the single leg hop test in the ACL reconstruction program, phase 4. My patient here is going to be performing the single leg hop test. She's going to be performing it on the injured leg and the uninjured leg, making sure there's only a 10% difference between the injured leg and the uninjured leg. And she's going to try to see how far she can go and just land on one foot to regain stability and return to her sport. So she's gonna bend her knees a little bit in this exercise and then pull her arms straight back and lunge herself forward just to land on one leg. And she's gonna perform these 10 times on the injured leg and the uninjured leg.